You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Dr. Pam Theriot. She's a TEDx speaker and a nationally recognized dry eye specialist. We're going to talk about some tips to preserve your vision and how to deal with dry eye. Dr. Pam is she's an optometrist, an author, again, a dry eye specialist based in Louisiana. She has over 20 years experience in eye care. She leads the Dry Eye Relief Center at Lusk Eye Specialists, where she helps patients with personalized care. I never knew that dry eyes was a big problem, but we'll get into her journey and why she deals with it and all that good stuff. So welcome, Pam. Thanks for coming.
Thanks for having me, Rich. I'm so excited to be here.
Yeah, when I look at your bio and it says dry eye, I keep thinking in my head, it wasn't a dry eye in the house. I heard that. I know it doesn't apply here.
Right. And, oddly, it is a big problem, and it's becoming more and more prevalent because we do spend so much of our days on our digital devices, which has a profound effect on the structure and the health of our eyes.
Yeah, I heard that because there's a study a few years ago that the average blink rate is X times per second, and people that are looking at the screen, the blink rate slows down and that dries out their eyes. Is that true?
So that's the gist of it, right? So we blink a third less. Normal blink rate would be 21 times a minute, and we blink only 7 times a minute while using a digital device. But it's not just that our eyes are drying out in that interblink period, but that we should be putting our two eyelids together. And when we put our two eyelids together as a blink, it causes the oils that are in the glands in our eyelids to be expressed and spread across the front surface of our eye. And by not doing that, 2/3 as much as we should, the glands in the eyelids are atrophying, and actually the oils in the glands are hardening, so that decades and decades of staring at these devices and having this reduction in our blink rate, we're actually seeing damage to those structures, permanent atrophy of the glands. And the not having enough oil in your tears, as you can imagine, would dry them out.
What happens if you have fake eyelash? I see women sometimes with like these gigantic fake eyelash. Does that prevent your eyes from closing properly?
Not from not closing properly, but the glue used to attach the false lashes to your natural lash often has formaldehyde in it. And formaldehyde is toxic to lots of things, but especially to the front surface of your eye. So no eye doctor is a fan of false lashes. And they also harbor a lot of bacteria and mites. And so you can get a lot of inflammation, styes, eye infections from having these lashes, artificial lashes on your eyes.
Well, so there you mentioned, you said some people, the eye has to close properly. Like, why wouldn't, I can see people blink less, a third less, but when they are blinking, is their eye blinking faster and there's like not enough contact time for the glands to express? Like, why would the eye close improperly? Or the two lids not come together?
Right. So I may have misspoke. I don't know. I'm just saying that if we don't blink our eyes regularly, then that 2/3 less blinking is going to cause the atrophy. But also additionally, using a digital device can cause these things that we call partial blinks, where the lids actually aren't coming together and connecting to one another. They're just fluttering and not spreading the oil out. If they don't connect top to bottom, they won't express the oil. So you just spread your tears across your eye without the oil.
Why does that happen? Is the material so engaging that the eyes won't even blink all the way?
Right. Yeah, we are focused more on a digital screen. Our blink rate decreases when we read in general, but there have been studies that have shown a difference between a paperback book and reading on a digital device. So just the act of reading, not even people who game, that definitely will decrease your blink rate because you're so activated on it. But reading material in general decreases your blink rate.
Interesting. Okay. I believe you said dry eye incidences are increasing.
Right. So it used to be just that women in the postmenopausal period were our typical dry eye patients because of those changes that happen with our hormones. Women were more prone to have this problem with aging. But now the people that are today 30 years old are the first generation born kind of with a cell phone in their hand. And if you look at these, again, looking at those oil glands on the inside of the eyelids, we can image them and we can see the damage of these 30-year-old oil glands because they have spent their entire lives on a digital device. Whereas folks like you and me didn't get digital devices until we were already adults.
You know, it's weird. My dad got a cell phone when he was 55, his first one. It wasn't even like a, like the iPhone or anything. I got mine when I was 25. And then my kids got, bailed out on my oldest till she was like 12 or something. And now kids are like born with a cell phone,
Right, exactly. They just live their entire lives on a screen. And that change has caused a lot more dry eye to come into my clinic at younger ages. But in general, all of us spend a ton of time on these digital devices. And so my purpose of going onto the TEDx stage was really to bring this into the light of a global audience, that really we need to take care of our eyes so that our vision lasts our entire lives. And there are simple things that we can do throughout our day to set our eyes up for success instead of, you're at your computer and you're rubbing your eyes and you're cursing them because your vision's blurring in and out and they're not for you. You're complaining to your eyes that, oh, why is my vision so blurred? Why do my eyes ache? But you're not doing anything to support your eyes ahead of time to allow them to make it through the day.
What happens when you have what's, I guess, diagnosed as dry eye? Like, what does it feel like? What is your day like?
So a lot of my patients, it starts when they first open their eyes in the morning. Their eyes already feel dry, they're stinging and burning. But then as they sit on their computers, their tear film dries out on their eye. And so the vision comes in and out of focus. And then maybe they rub their eyes to try and get it back into focus, or they stop, they put in an artificial tear. It's having a significant effect on our workforce in that distraction of, having to stop what they're doing, put in the artificial tears, go back to what they're doing, the frustration, the time that it takes, and then people, eventually needing to take time off of work to see a doctor to find out, what the cause is and what they can do to fix it.
Are there bacteria that eat like the oils or like, eat the stuff that the eye traps? Maybe there'd be like an eye drop probiotic that can help people with this,
Right. Well, there are some ways to get rid of overgrowth of mites and bacteria that just naturally live on our lids and lashes. There are ways to get rid of that. Generally, that's not the root problem in, just somebody who's sitting at their computer and struggling through the day. But the problem is that decreased blink rate. There are ways, like I was saying, that you could prepare your body, support your eyes so that your vision can make it through the workday.
Oh, so what can people do? Like just take deliberate breaks, sit there and close their eyes for 5 minutes, or what do they do?
Yeah. So I have a 3-step process. It's called prepare, perform, and preserve. So in the prepare stage, you would, set your workplace up for success and make sure that the screen was in a downward gaze. It was arm's length away from you. You had your font size set up properly. And maybe you've seen your eye doctor in the past year and gotten your prescription, precisely either made for your eyes in general or a specific pair set up for your computer viewing. And then in the performs part of the equation, that's where you're actually on your computer, making it through the day, trying to, getting your work done. That's where you would take some small break to blink your eyes, rest them, maybe set up a humidifier at your workstation so that you had moisture in the air surrounding you, giving you that little extra boost. And then the final section is the preserve stage, where there are 4 simple steps that people can take every day to really take care of their eyes, just like we brush our teeth, floss, mouthwash. There's 4 simple things that you can do to your eyes to keep them healthy and your tear film robust. Are you ready?
Yep.
Okay, so 4 simple steps. The first is artificial tears, and that would be something simple, a preservative-free tear that you could leave by your computer or your workstation to just hydrate your eyes as needed. The second one is a lid and lash cleanser. So just like we brush the plaque from our teeth every day, We can scrub our lids and lashes to remove dirt, dust, debris, pollen, eye makeup, anything that could be caught in our lashes that would cause inflammation if you went to bed, wearing that. So a lid and lash cleanser. The third is a warm compress. So putting a warm compress over your eyes as a break when you're at the workplace or at the end of the day is going to give that soothing heat that allows the oils that are trapped in your lids to seep out onto the tear film and then act to coat the eyes, lubricate the eyes more readily. And the fourth step is actually to take a nutritional supplement for the eyes. There's two that are on the market that are science-backed. And the first is an omega-3 fatty acid supplement that gives your body the building blocks of that oily layer of your tear film. And the second one is called Blink NutriTear, just put out by Bausch & Lomb, that actually reduces the inflammation in your tear film with a combination of curcumin, vitamin D, and antioxidants like lutein and zeaxanthin. And they have some clinical trials that has shown an increase in tear production using that supplement. So those are the four simple steps that I encourage my patients to take daily.
Or why does one supplement, you think, increase the tear production?
So dry eye disease is driven by inflammation, and the inflammation on the front surface of the eye decreases the sensitivity of the nerves on the front of your eye. And those nerves send signals to your brain to tell the brain to make tears. And so when the inflammation is higher, the signal gets lost. Over time, it can damage those nerves so that the signal doesn't even get to the brain to make the tears. So bringing down the inflammation on the eye can then increase your tearing. Yeah, it's wild.
What are other reasons that people would get dry eyes?
Oh, yeah. So there's a ton of them. It's a multifactorial disease. So not only using computers, but often medications that we take decrease our tear production. And some really common ones are allergy medication. And taking an antihistamine will significantly decrease the tears made in your eyes. And luckily, most people take antihistamines only sporadically, but there's other more daily medications like antidepressants or beta blockers that you might take for high blood pressure, birth control pills that also you would take on a daily basis and reduce your tear production.
But what else can cause it? Like, what if someone gets like a LASIK eye surgery? Would that predispose them to that? Or, as people get older, do their glands have more trouble producing the tear oil?
Right. So there is some loss of tear production and decreased oil gland secretion as we age, just naturally. But having ocular surgeries like LASIK surgery or even cataract surgery, they change the nerves. So depending on which surgery you're talking about, the LASIK surgery, when you create that flap, it actually severs the corneal nerves that go from the eye to the brain. And that's that signal I was just telling you about that tells the brain that the eye is dry and that it needs to send to make more tears. And so those nerves will regenerate after you've had LASIK surgery. It takes a few months for them to completely regenerate. And why, if you have LASIK surgery, we encourage you to use artificial tears on a regular basis in that postoperative period to support your eye and help the nerves regenerate. But that's a good call out of what, of surgery that could cause dry eye. Also, your sleep habits, lack of sleep can really affect your tear film. So most adults aren't sleeping 7 to 9 hours on a regular basis, but they should be in order to allow our eyes to heal properly at night and get the support that they need for the next day. We really need to close them completely and for 7 to 9 hours.
Yeesh.
And the other things like contact lenses, people who sleep in their contact lenses, that can be very destructive.
Yeah, I heard that they have gas permeable ones now, but I guess otherwise it blocks oxygen from getting to the surface of the eye.
Right. Gas permeable lenses are otherwise known as hard contact lenses, but soft contact lenses are the ones people generally sleep in. And they do have oxygen permeability, but once you close the eye and then you're wearing a contact lens, that oxygen permeability is significantly reduced. You're trapping things on your eye that may have gotten attached to your contact lens during the day, and then you're sleeping with those things up against your eye all night. It leads to risk of infection, irritation, inflammation in the eyes. So proper use of contact lenses is a huge benefit, using them, cleaning them properly to, keeping your eyes healthy for a lifetime.
Very good. What's the best way for people to, they can listen to your TEDx talk, but, what else can they do to make sure they have good habits to take their eyes and their eyesight?
Right. So I recommend that everyone get an annual eye exam, see your eye care professional every single year to make sure not only that you're seeing well, but that the health of your eye is preserved. And I also put together a handout for anyone who's listening to your podcast so that they could download the tips that I gave for the TED Talk and preserve their vision in our digital world. And that's available at my website, which is Pam Theriot, which is spelled PamTheriot.com/TEDx.
Okay, very good. Well, Pam, thanks so much for coming on the podcast. I appreciate it.
No problem, Rich. Thanks for having me.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.